Well, here in just outside Geneva, it's actually a beautiful morning. And so I'd like to wish everybody a very good day, wherever you are. And thank you for joining this open online briefing on the 23rd of April. And it's lovely to see so many people that have been on our previous briefings, but also one or two people who had come for the first time. The usual pattern is that I start with a brief resume of what I'm focusing on right now in my role as WHO's envoy on COVID-19. And then I stop and we receive questions or comments that come in through the chat, and then we reply to them. So it does become interactive, even though obviously we don't find it easy to open up for comments. If you do wish to make a remark, and you really feel that you have to come in either with an illustration or with a question, please do so. Please let us know. And if we can bring you in, we will. We've managed to do that on one or two previous occasions. Focus of my remarks today are on what is happening in societies all over the world as people try to make sense of the COVID pandemic and think through what is going to be the future and over the coming few months and years, the new reality of living with COVID in our midst. And I want to start by offering some perception about how that new reality is coming through in different people's minds. And I sense that more and more members of the public, people in business, decision makers in government, and the wider civil society are realizing that this virus isn't suddenly going to go away. This virus is here and is going to continue to harass us as humanity for the foreseeable future. What might happen? Well, in due course, there may be a treatment that makes sure that everybody who's attacked by the virus is able to shake it off quickly. Or there may be a vaccine that makes sure that everybody has the ability to be immune to the virus and doesn't get affected. But there are so many questions still about whether or not a treatment is going to appear and whether or not, having had the virus and been infected, you are immune and protected, that it really is important that we actually focus on what life's going to be like for the next few years. And when I'm asked, I'm usually saying, I think it's 2 to 3 years before a vaccine will become available and be widely administered. And yesterday I was talking to some investors who were trying to choose where to put their money. And I was trying to make the point that there's no value in trying to rush vaccine production and cut corners, particularly on safety, because then that would have terrible consequences. People would just reject being vaccinated. So I was very much saying, don't bank on a vaccine becoming available too quickly. And I think that that was the right advice. Of course, whenever I've given quite firm advice, I have to afterwards ask myself, was that the right thing to do? But yes, I'm saying it will be quite a long time before there is the vaccine or the treatment. And so really learning to live in an environment where this enemy is continuing to hassle us, if we use the military language, or simply learning to live with a virus that can cause harm to society is really important. So I listened on a briefing yesterday to President Duque of Colombia, describing what his country is doing. And I found myself really absolutely, totally in awe of the way in which that person, as president, had just got all the elements very, very clearly and was setting them out to hundreds of business leaders on a World Economic Forum call. And I did think, if I wanted to rate a head of state for what he's saying, what he says and how he communicates, I would give this guy really, really high marks. Not only because he understood that it's not a case of balancing public health versus restarting the economy, but because he was able to make the point that actually you've got to get the public health right in order to restart your economy. You've got to get the public health right in order to enable all your low-paid people in the informal economy, 80% of those 70% of people in his country, to make sure that they can get cash and they can get food and they can live. And so I'm really delighted with that folding together of the health and the economic message, and that strong focus on social protection that he was describing, with making sure that workers are able to get cash even though they are not able to be in employment in the way they were, because the lockdown has reduced economic activity. And then while he was talking, I was also listening to him describing how they've done everything to protect part of their health service and hospitals so that they can treat people who've not got COVID, who've got other problems. And he said, we're preparing the population that sometimes we may have to reimpose lockdowns over part of the country if the virus comes in with a great big, if the virus comes in with a great big outbreak. And I thought, good, he's preparing people for that necessity to be able to reimpose movement restrictions, because that's the most important thing to do. If you get a big outbreak, you don't want it spreading to other parts of the country. And I suppose what I'm really saying to you today is that this anticipation of the COVID-ready society and what that might mean in different settings just seems to be coming through in many, many different locations. And I'm really excited to be accompanying different business leaders and different civil society actors, different governments, as they're just weighing up how best to do this. I keep wishing that there was more international collaboration, but I'm finding that this public health network that I've always said exists between different public health leaders around the world is very alive and active. There's a lot of communication between each other. Where's the virus going? How well have the lockdowns worked to try to slow the spread? How are we managing with trying to make sense of shortages of PPE? How do we share with our people, but we want them to be ready to mask their faces, but we don't want them to take the very specialized, high quality masks away from health workers? What are we going to do for older people to make certain that they are going to be able to continue to meet their relatives and are not going to be ghettoized? And then how to ensure that all the other essential parts of society are able to keep going, even if there has to be quite widespread physical distancing. I just feel more and more and more groups almost simultaneously are coming together saying, yeah, this virus isn't going away, and therefore we are going to have to work through how to deal with it, but in a way that is not so much characterized by violent antagonism. Yes, there are people saying we've got to get the economy going, people are hurting too much, and that is absolutely right and understandable, but they're not saying that means we just let the virus go and tear through our communities and kill a lot of old people. I sort of sense that understanding that it's really not an either or is beginning to spread. What about what's happening in food? Well, I also think there's an understanding that when you do a lockdown, there are the two ends of food chains that get badly hurt. The people, particularly poor people, and their families and their children in places where economic activity has been disrupted. We've got masses of evidence now that there has been a huge increase in hunger. In some places, there's also been some rioting, not widespread, but if people are frustrated, they're not getting the food they need, or a supply truck gets hijacked, or some other mess happens on food distribution, then we see there are some tensions that naturally build up quickly. And then we're also getting all this information about the terrible problem for farmers who produce vegetables, fruits, dairy, and other perishables, and whose markets have just collapsed suddenly. And so both the farmer end and the consumer end in difficulty with malnutrition levels thought to be rising. Of course, you don't have immediate data on this kind of thing, but our colleagues on the nutrition community are saying we're already finding that kids are suffering. So I'm hearing more and more examples of imaginative ways by farmers to short circuit supply chains and get food directly to urban consumers before it rots. And that gives me great hope. And I think that inside all this work that we're doing on COVID-ready societies and the shifts that we're seeing in food and in other areas as people think this through, we're also seeing very optimistic signs of new trends and new ideas emerging all over the place. And I suppose where I want now to be really placing myself, and I'd like our 4STD team to be placed, is on just sharing examples of where there is really imaginative new ideas being put in place, where people are experimenting, thinking about the way in which their businesses are going to adapt, the way in which their residential care practices are going to adapt, the way in which their custodial areas like prisons are going to adapt, the way in which they're going to change what happens in air travel or what happens in sea travel, and just thinking it through and trying to work it out. And all the time anticipating better technology, like better virus testing that's quicker and can be done at a particular point, or anticipating better PPE that can be reused without worry. And all that stuff is going on all at the same time in multiple locations. I've never, ever been in a situation where there are so many people in so many places trying to work through the same challenge and thinking it through in their different environments and doing it in a way with such really exciting will to share. And that brings me towards the last point I want to make on this introduction. Yes, on the one hand, we had last week a rather distressing sign of one government saying, we're just going to get angry, we're going to walk away, we're not going to be part of this public health network that's coming together to try to work through these extraordinary challenges that none of us individually can possibly cope with. But I'm seeing, again, signs from the US being contacted by people from that country saying, we're just beginning to realize that actually to pull out, to try to be independent is just not the cleverest thing to do. We're beginning to realize that to deal with some of these challenges that are now so massive and that everybody is trying to wrestle with, releasing from lockdown, getting communities COVID ready with strong case finding and contact tracing, developing better point of contact tests, working out what to do with older people, how to manage the food challenges, all that stuff, realizing that actually it's happening everywhere. It's not just happening in the US or not just happening in Britain, it's happening everywhere. So what on earth is the point of communities and countries saying, well, we're going to do it our way and just sort of shrugging off the rest? Everybody's looking at Austria and Germany and seeing what happens. The new German face protection instructions came out yesterday and people are saying, wow, if Germany's doing that, then probably that's setting a standard for the rest of us, because in a funny way, the German performance has been really excellent and people are looking at what Germany's doing. And then everybody says, well, Singapore, they've gone backwards, but then others are saying, no, but Singapore was expecting new flare-ups to occur. They actually built that into their planning, and they've done in their guest worker dormitories, as they've had COVID coming in, they've done the right thing. So where are my worry points? Well, first of all, I continue to say that in a country where the head, the federal chief says one thing, the sectoral ministries say another thing, local government, state government says another thing, and local government says another thing, what I call inconsistent policy making and practice. In places where we've got inconsistency, there are problems. And this is something that I know many of you have been looking at. It's evident that that's been a problem in Spain. It's evident that it has been a problem in Italy. I think they're being rectified. It's evident there's been a challenge in the United States. And I think it's something that we just need to really hold on to, that to get on top of COVID, there is an absolute need for consistency through the different levels of governance. Otherwise, there are immense problems with implementation, whether it's dealing with data, and data are really, really important for knowing where the virus is, or dealing with the response, particularly if you get a flare-up. You know, if you've got one part of the country having one policy on reimposing lockdowns and another part having another policy, it's a terrible mess. So this, what I think really is called vertical consistency, is absolutely key. It does not mean that you stop having differences in different areas depending on how the virus is, but it just means that you've got shared triggers and signals across the country and people understand what is going on. Secondly, countries where the head of state is giving out messages about the severity of the virus that are very different from what's happening at other levels. So a kind of, one could say, I think, a cognitive dissonance, but I'm not sure whether that's the correct use of the term. I'll ask some of you to tell me, where the cognition at different levels so obviously varies. And that's the situation, I think, at the moment in Brazil. And I think that is problematic, but I suspect that the recognition that it is terribly serious in Brazil for indigenous peoples, what we kind of were expecting, and I think some of you know that we were trying to find out what's happening in different indigenous communities because other pandemics have preferentially hit indigenous communities. But I think the news yesterday from Manaus in Amazonas in Brazil, that actually there does seem to be something terrible happening right now. I'm absolutely certain that's going to focus Brazilian minds, and that will try to align the cognition through different parts of government in a very profound way. And then the third area, my last point, relates to international collaboration. In my own thinking last weekend, I was saying to myself, it's not whether there will be international collaboration, it was simply when will it happen? Because of my anxiety that if you've got slow international collaboration at all levels, then that will just add to the terrible inequities that we know are going to be exacerbated by this virus between rich and poor. But that if the international collaboration is really bad, then that will just mean the inequities will be greater. It'll be much harder for poor countries to connect into the global economy when things are reopened, if there's not good international collaboration. And I've been just talking to various diplomats and so on over the last 2 days, saying, is there the mood to really start some strong international work in the multilateral system on thinking through at the very beginning, what are going to be the priorities for the vaccine when it comes, who's going to get it first, what are going to be the priorities for sort of debt relief, what are going to be the priorities for restoring and rebuilding public health in poorer countries so that they're going to be able to be connected to other countries, what are going to be priorities for certifying whether or not countries have got adequate COVID ready state. I mean, it's so blindingly obvious to me that there's going to be masses of international collaboration needed. And so I am getting signs that more and more leaders are just beginning to say to themselves, yeah, we have to cooperate. And so, I mean, I just wish it would be quicker. I'm very pleased that the European Union is beginning to get it together. I'm very pleased with the work of the WHO regional director right across Europe, who's just solely focused on this and is really putting his whole time, night and day, into bringing both Western Europe, Central Europe, and the former Soviet Union into some kind of alignment. I love the way in which the African Union is working. We've got a call with senior officers in the Economic Commission for Africa today, and she's going to, I'm sure, tell me that Africa is really focusing on this with a continent-wide approach. And so I think it's coming. I keep saying to myself, yeah, bit by bit, there seems to be a widespread recognition that we all have to pivot for this vertical consistency within countries, this cognitive alignment between different leaders in countries. It just doesn't work to have leaders saying hydroxychloroquine is the answer and this is a mild problem. but most importantly, the international collaboration. So that's a bit of a sort of multiple area thing that I'm trying to share with you. Started by saying I'm focusing on interpreting and accompanying those who are doing changes. I talk quite a lot about what's happening on food and the way in which I believe that there is a greater recognition of the places that are hurting inside food systems. I was speaking quite a lot about how businesses are aligning and adjusting and changing the way they work. I talked about the national approach in Colombia, saying that this is not an exception. This is a sign of many developing and middle-income countries saying, yes, we're listening to the WHO. We don't want to make the mistakes that were made by some countries that took it lightly. And then just talking a little bit about the emergence of aligned thinking within nations, aligned thinking between leaders and their people, and the importance of international collaboration. That's my two last points, because these have come up from some of you who've been attending these briefings. A, remember that health services have been totally pushed towards COVID in many parts of the world in the last few weeks. Don't forget there are people with other conditions that haven't been able to get diagnosis and treatment. And so there is a real need, to make certain that health care is available for non-COVID people. And that's got to be remedied quite quickly. And that's come actually from a colleague who used to be with me on strategy in the World Health Organization, Andrew Castle. Some of you might know him. And he's saying this really strongly. And we're getting that message from many others. Polio immunization suspended for COVID, malaria treatment not being provided for COVID, maternal and child health care, and particularly antenatal care, being reduced because of COVID. And I think that just focusing on healthcare is a really important issue. And then secondly, and I expect this will come up in the questions, what's going to be the life for older people as we come into the new COVID-ready state, the next normal, as I heard it described yesterday? Is this going to mean that old people are going to be permanently unable to meet their younger relatives because of fear that the younger relatives will bring COVID to the older people, especially in residential accommodation where there's such fear? And then a person who used to work with me when we were involved in, I was involved in health in the Department for International Development, or DFID. She wrote and said, there are some really serious human rights issues here. There are really serious issues about social connection. And we have to, as a society, really be working these things through. Any effort to age stratify when lockdowns are withdrawn, and with old people being asked just to stay at home and not being able to receive relatives, would be very damaging. And I'm thinking about that, I'm thinking, of course, and it makes me think, gosh, in every single area where COVID is revealing fragilities in our systems, there are so many complex issues that have to be worked through without simple, just textbook answers. These are things that have to be discussed and debated, because it's an understanding of the risks associated with different strategies. It's not a black or white thing. It's, are we prepared to accept a degree of extra risk for old people in return for their relatives being able to visit? And how are we going to be able to manage that? And as this work goes ahead, I just find myself thinking, gosh, this is going to require a lot of thinking by all of us as we try to make sense of it. And so that brings me to the end of my opening remarks, and just sharing with you that really I think the role that we all have to perform, not just me, but all of you, is about interpreting what we know, as well as explaining what we really don't know, and then accompanying people as they try to work through what this means in their own lives, in their own families, in their own workplaces, as they go through socializing, as they wonder how they're going to redo sports events, how they're going to restart conferences, how they're going to restart airline travel. It's just not easy. And that's in fact, I think, as it was meant to be. This COVID has come along to pose all of us, some amazing ethical and existential challenges. And that's what we're going to have to show that we're capable of doing as the human family, is being able to work through these issues and find solutions. And I know that your comments and questions will be taking us all into this space. They'll be challenging. And so I look forward to sharing with you. Just to, you know, I love during these open online briefings to explain to you all who we believe is on, not by identifying names, but just saying where people are connected from. I'll do it geographically, just because I think that it helps. So we've got people here from Manila in the Philippines. Hey, hello. I think it's probably quite late night for you, or late for you. Thank you very much for joining. We have this at this time designed for people who are east of us to be able to join. Thank you. People from India, really lovely to be connected with you. I want to stay connected to people in India as much as I can. There are so many features of what India's response has been that I've learned about only because of connections in India. And I'm really, really excited and impressed by the way in which the people and the government of India are coping with this and trying to freeze that virus where it is, and then find the people with the disease and isolate them and find their contacts and isolate them, and try to prevent it from spreading extensively in the country. Still questions about how serious the virus is in India. And for my colleague who's called from Manila, really impressed by the way in which the Filipino people are coming together at community level to deal with this threat. Colleague from Tunisia, thank you for joining. I know that Ramadan starts tomorrow. I've been talking with colleagues and friends who've been focusing on the challenges, but also some of the opportunities of communities coming together and helping each other in the Maghreb countries. My information has come from Tunisia. And thanks very much to our friend from Thailand, Liviu, who joined us last time and who's back again with us. Liviu, it's great what you're doing, and I'd like to see you waving. Great what you're doing, and thank you for bringing up so clearly last time some of the really exciting opportunities, and I'd like you to come back and make any comments that you might want to make if you've got a moment, just to say how things are going, and particularly describing some of the experiences in your region. Colleagues are from Egypt. Now, Maha Rabat, the former Minister of Health of Egypt, is one of my fellow envoys, and she's been writing to me and saying there are some really exciting developments in her region, as people are just saying, yeah, okay, we're going to actually come to terms with this, and we're going to find ways of being able to go through Ramadan and do our prayers and run our lives whilst paying attention to the dangers caused by the virus. I think that it really is serious, of course, and we've seen in some countries how coming together for religious festivals can act as the moment when transmission is amplified and centrifuged to different places. So thank you for that point. And then we got people from France. Bienvenue, thank you for being with us. And really, they're very, very impressed to see how, again, the French people are working together, again, debating and questioning, but it's all the time saying, but we know there's no rule book for this. Stuff is having to be made up. The government is having to do experiments. There are going to be differences of opinion among different people. In France, everybody debates. You hear it on the television all the time, as in other countries, but that's so good and so right. In Switzerland, always watching the sort of quite calm approach of the Swiss, but we do also know that there's an awful lot of COVID in Switzerland. Some hospitals are really stretched, others not so. Again, trying with their own approach to movement restrictions. And colleagues from the UK, thank you for joining us. Obviously, we have quite a lot of connections in the UK, family and friends. And again, there I'm watching. It's interesting sometimes, I think in the UK, there's a real obvious wish of ministers to be trying to put out one piece of good news each day at the daily press conferences. And yes, I think that's right, but I think we also need constantly to be sharing with people, you're all part of these experiments to try to find the new way of living with COVID. We're all one family and we've all got to do it together. And there's no actual group who really know all the answers. Those who are using, those who are trying to offer advice are basing it on what we're learning from other countries, and it's super public what we're learning from other countries, despite what anybody says. Actually, there's such a lot of information coming through on social media, on print media, obviously reports to WHO, and actually there's just no wish of people to hide, not at least in my understanding, unless they are repressive regimes who would just have to hide everything, because people are realizing that this is a totally new situation for the whole of humanity, and we're all learning together. It's a kind of giant joint learning exercise, and we're all finding our way through it. And we're enjoying, to a degree, excuse me, sharing with each other and trying to find ways of working together. So I'm in that mood with you of saying, you know, I hope that you feel and enjoy being part of this collective learning. Just want to say that I like all the time to stress to everybody that 4SD is a team. I'm lucky because I've got the role that enables me to be the spokesperson and envoy, but we are backed by John Atkinson, who works with us on living systems leadership, and we put a lot of work by John and me in some cases on www.4sd.info, call it Living Systems Leadership. Tweet and Guian, who is helping us with all our communications. She has basically taken our website and tried to make it more accessible to readers. And I think it was Twee who was hugely involved in developing a little video. It's just simply very short, 1 minute, I think 47 seconds, but it's now got subtitles in Arabic, subtitles in Italian, subtitles in French, I believe, just on what the COVID ready state might be. And although the images are a bit Western, because the people who put it together were using images from people they were connected with, we're finding that there's a lot of people taking that video and playing with it. So especially if you find that there's a network that you can share that video through, please let me know. I have found that big sporting networks have started using it, and we want to hear back. Is that video approach that we've done good? And also I'd like to know whether or not the way we presented the narratives on our website is helpful. We see us as interpreters of WHO guidance, as accompanying people. We know that there are things we need to put into our narratives and videos, and we are reacting, but we need to know more. And one of the most difficult ones we're trying to do at the moment is how to be COVID ready in poor settings where people are living in very dense circumstances. And we don't actually have all the answers. And so the only way we can actually answer that question is with a lot of further questions to stimulate discussion. But goodness me, I think those kinds of framing questions are helpful. Catherine Deland is on our team. Catherine has worked with the World Health Organization for ages, and she's been able to help us find points of entry when people say, I've got a new way of protecting PPE so that it can be reused, or we've got a really good new design for a ventilator that can sit in the back of an ambulance and be just made out of almost very simple parts, or we've got new apps that can be used. And I think we don't want to become necessarily a clearinghouse for everything. We just aren't equipped to do that. But we are able to really highlight when there are really exciting technical developments coming along, connect them with WHO, or connect WHO with some of the networks around. It's incomplete. And that's the case with, I was just saying this with Florence yesterday, that so much of the time we find that there are things we just would love to do, connections we would like to make, but we just don't have time to do it. There's so many opportunities arising. And so I encourage all of you to at least see that the thing you can do most at this particular time, as people are all trying to come to terms with what's possible and what's needed, and developing new applications and technologies, just spend your time connecting. You never know what these connections are going to lead to, but now more than ever is the time to connect. And Catherine is the ultimate connector. Joe Colombano brings with him deep experience of the United Nations, but also an ability to understand the economics. And he's linking up with people, again, somewhat serendipitously, but these are friends and colleagues and even family members who've been working on some of the economic challenges, particularly this issue of should national funds be used to bail out big businesses when they employ a lot of people, or should they be preserved for small and medium enterprises, or giving benefits to the unemployed or people in the informal sector who are without jobs? You know, these choices that are having to be made by national treasuries and ministries of finance, given all the different calls for resources to try to keep things afloat and to stop people going into poverty. These are horrendously difficult. I mean, nobody can say, oh, well, if it was done on a rights basis or on a equity basis, it would be this group that has to be favored. No, because political economy is never like that. And Joe Colombano, because of his economics background and his work in the UN, has been able to show us that. Magali Mahdi, thank you for not just holding together our schedules, but connecting with NGOs and showing us what they're doing. Sabah Momen, thank you for all the information about Tunisia. Julian Delamontex has been able to give us background of what's happening at the commune level in France, but at the same time is able to link to what he knows from his working in the private sector before, and again gives us that flavor. And then Flo Lasben, who's really taken the food work that we're doing under her wings and is taking that forward. She's making signs to me to move on and stop talking about the team. But why am I talking about the team? Because what I wanted to do was to show you that in our team, we've really pivoted from focusing primarily on amplifying WHO's guidance to now trying to interpret what that guidance might mean in different settings, and then to accompany people in government, both local and central government, in business, in civil society, in professional groups, in community organizations, and more broadly, people everywhere, as they try to find ways to come to terms with this new reality without being incredibly affected by it. Now, I come to your questions. I thank you so much for sending questions and for giving us what you're thinking. We try as far as possible to capture your words when we write down your questions. But here, again, thinking through what this all means, I can see even the first question, you're right in line with where I'm at, and so it gives me a chance. I won't give long answers to the questions so we can do as many as possible. If the time frame for getting a handle on this pandemic is another 2 to 3 years, that is sometime between 2022 and 2023, I would imagine there will be increases in business closures and in general economic losses and even negative growth. If this is the case, how will the 2030 Agenda for Sustainable Development be achieved? That's come from a colleague in Manila. First of all, thank you very much indeed for what's happening in Philippines, and thank you particularly for this question. I want to stress that as far as I'm concerned, the challenge for humanity is to find ways of going on with our economic lives, our social lives, our political lives, our family lives, with the constant threat of this virus in and around us, but adapting our lives so that we can live with that threat and we can go on and prosper and have good lives despite that threat. And so the first step is to make sure that everybody everywhere knows what they have to do in order to be able to prevent themselves from getting sick with COVID and preventing chains of transmission from building up and outbreaks from becoming explosive. That's a total behavior change activity that's going to be done quickly, and I feel it happening already. So I actually believe that societies will be able to protect themselves. And I believe that public health services, including in your country, will be able to support that societal capability with very well developed capacity for detecting, testing, isolating, contact tracing, rebuilding, repurposing hospital services. So essentially that basic capacity will be in place. Some countries will do it quicker than others. It's my belief that Philippines will do it quite fast, just based on my understanding of community capability to organize and also the public health capacity. So my goal is that communities and nations should be sufficiently able to deal with re-emergence of and outbreaks of this virus, that businesses will be able to thrive and prosper in that context, even though it's going to mean some adaptation to business practice, adaptation to restaurants, adaptation to personal services, adaptation in residential care, adaptation in a whole series of other areas, but we will find ways of doing it. And within that, this is my next point, we will learn that we have to collaborate on not just getting our societies COVID ready, but getting our societies more equitable and more sustainable. So actually, as a result of the shifts needed for COVID readiness, there will also be shifts, I believe, in line with the 2030 Agenda for Sustainable Development. It's the choice is up to us. It's up to us whether or not we want that. And I believe that we will see an emergence of a great focus on and support for the Sustainable Development Agenda as part of the transformations needed for COVID readiness. Why do I say that? Because I see so many signs already. That aspect of humanity is emerging more and more. But of course, we have to wait and see. Everything can be knocked on its head by intolerance between political leaders. But I kind of somehow think that that won't happen. I think that there will be a much greater recognition of the need for collaboration around the sustainability agenda. Yesterday was Earth Day. I think that's focused my mind a lot. So question 2, how will more people get back into work without starting more outbreaks of infections? So this is basically saying the same message, but framing it in a different way. Obviously, when you release lockdown, there's more movement of people. More movement of people means that that virus, which is lurking in amongst us, has more opportunity to spread. More opportunity to spread means more opportunities for explosive outbreaks. But we have to keep remembering it's up to us to stop explosive outbreaks from developing. It's up to us to make sure that we identify people with the disease based on their symptoms and we get them to isolate. It's up to us to be able to find ways to isolate whole communities if that's what's necessary. It's up to us to make sure those communities, when they're isolated, are properly supported. It's up to us to find ways in businesses so that people can get back to work, but as far as possible maintain physical distancing. It's up to us to find ways to develop face masks that actually are good coverings, that mean that if somebody does have a symptom-less or low symptom COVID, that they, when they are close to people, they're not necessarily affecting them straight away. These are going to be up to us. They're not actually going to be all about governments. They're going to be people actually taking responsibility and doing this. And if this is practiced everywhere, it's certainly going to be possible to get back to work. It's certainly going to be possible for work to be as effective, as remunerative as it was before. And it's going to be possible for us to be able to defend people against major outbreaks. It's going to be difficult in some areas, and I keep saying it, residential care will be the sign of how well we're doing, because that's one of the most challenging areas. It's going to be difficult in very overcrowded communities. But I very much hope that everybody here is conscious that this capacity to get economies started again is very much going to be dependent on the extent to which people can work together. And as I keep saying, that message is coming across more and more, but not in a very unpleasant way where there's going to be a lot of unkindness to people. I think it's a true recognition that the people who are prepared to isolate themselves when they have early symptoms of COVID are the ultimate societal heroes. They're not to be stigmatized. They're the heroes because they are taking responsibility for the health of others, and that matters so much. Question 3, can I talk about the difference in concern between food security and malnutrition and how they're impacted by COVID? As probably many of you know, but I'll just say it again just to put it in a capsule. Children, particularly during the period between conception, before born, obviously, and then the age of 2, it's about 1,000 days, are incredibly dependent on good nutrition in order to be able to grow and develop to their best potential and turn into adults that will make the optimal contribution to their societies, as well as having the best opportunity for being strong and earning a good income. There's a really excellent series of scientific articles that appeared during the last 15 years showing the correlation between good nutrition in early life and performance, and even health in later life, with some suggestions that undernutrition in early life actually predisposes to heart disease and diabetes in later life. Early nutrition really matters. But you don't get good nutrition just from eating, say, rice or wheat just on its own. You just don't get enough of the necessary ingredients for good nourishment. For that, you do need to have fruits and vegetables, and ideally dairy products, which are high in vitamins and energy. And you need the protein, either from plant sources or from meat. All these are essential contributors to skeletal growth and essential contributors to being strong with an immune system that can fight infection. And I call having those nutrients and being able to access them when you're very young, I call it nutrition security. And it really is all about being able to be adequately nourished. Now, there's another term that's used, which is food security, which is basically about having enough grains in order to not feel hungry, but it doesn't really adequately cover the nutrients. So I'm now increasingly, when talking about this, asking people to think in terms of nutrition security, especially for pregnant women and indeed all women, because it is an absolute necessity for women at all parts of their life to get a whole series of vitamins and minerals. For men as well, perhaps it's less significant, but still it's important, but most importantly for young children. And so it's still a bit of learning that's got to become more widespread in society. In early life, good nutrition really matters. And that means focusing on classes of food that will contribute to good nutrition. And right at the moment, there is a recognition in many countries that means making sure that perishable foods are more widely available. Question 4. People have other reasons for cough and sneeze, such as seasonal allergies. How will neighborhood health watches work if there are multiple possible causes? This is going to be really difficult. And of course, enabling everybody with symptoms to have themselves tested for virus is the answer if you're going to get community level identification of people with COVID. I agree. And one of the things that I'm really keen to promote and encourage is the development of a test which enables people with live virus to be detected and to be therefore knowing whether or not when they've got their symptoms they're due to COVID or due to something else. And yes, there are going to be problems of differentiating between the symptoms of a person with COVID and there's somebody who's got allergies or who's got the flu. This is going to be problematic. And I think that it's going to be really, really important that testing does become more widely available so that it doesn't become necessary to isolate people with other conditions. So right, thank you to the questioner. And of course, the more we get skilled at identifying the actual symptoms that are very precisely associated with COVID, the easier it will be not to isolate people with other conditions than not COVID. And that's why this continuous work that a colleague called David Liu, who I work with in the US, has been doing to try to really get a clearer and more precise symptom definition of COVID. This is really important. And so as this work emerges, we'll share more with you. He and others are saying it is loss of smell and taste just before you get the other symptoms appearing that seems to be really important, plus certain blotches on the feet, which are kind of little punctate blotches, red in color on the feet and white toes. They're all beginning to be part of a sort of symptom complex for early COVID, which helps to distinguish between COVID and other conditions. All work in progress. Do share with us, by the way, if you hear of people doing any of these kinds of things. We're all learning together, and I like us to be a kind of learning community. Question 5. How do you see the international collaboration being started? Can the World Health Organization take it to the UNGA? At the moment, it doesn't seem that there is the political will at global level as opposed to interagency collaboration. What can be done by civil society organizations? If I was leading in civil society right now, I would be encouraging a worldwide petition, a kind of citizens' resolution with probably 5 or 6 points, not very long, on what I would want the heads of nations to be doing at this time in terms of collaborating on ensuring health workers get the protective kit they need, on in strengthening public health services in communities and being able to demonstrate that they've set up really effective systems for interrupting transmission. And then for dealing with food insecurity and other challenges associated with the inevitable lockdowns that will be introduced. And then for movement of stuff across borders so that there's not any hiding, as well as movement of information between countries. And then the opening up of a constant process of regular meetings between delegates from different governments to deal with all intergovernmental issues as they come along, because there are so many of them. Intergovernmental issues on the norms for travel, intergovernmental issues on best practice for dealing with challenges in prisons, intergovernmental issues on the proper respect for and rights of older people. I keep feeling all these things coming along and the absolute need for this. And I actually think a lot will happen during the World Health Assembly, which will be held virtually next week. This is actually governed by representatives from all countries. And I think there will almost certainly be a resolution at the World Health Assembly, but I would love it if there was a petition from millions of citizens that emerged. It wouldn't necessarily be the same petition. It would come with different angles from different countries and different peoples, and it would probably be a big mix and a hodgepodge of stuff. But gosh, I wish that sort of citizens' voice saying to world leaders, we understand you've got your differences. We understand that you've got to promote national interests, but just for now, please, 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 7.8 billion people trying to cope with this stuff. Come on. And I mean, I think it will happen, as I've said earlier on in this talk, but I just want it to happen now, because the longer you wait, the harder it will be. I say this repeatedly, because the longer you wait, the more damage there will be. Question 6, what could we have installed and done better between the last pandemic and now? Everything. Oh, I say, World Health Assembly is not next month, isn't it?
It is next month, not next week.
Okay, I got that wrong. Next month. That was a slip of the tongue. Thank you very much indeed. Next May, in May. What could we have done better? I don't know whether you wrote that question, Liviu, but just saying that what we learned after previous pandemics is just you have to prepare right across all the sectors, because there are cascading challenges. It's a health problem first and foremost, but then you get challenges right across all sectors. You get food problems, you get transportation problems. You can't predict exactly what's going to happen. So the other thing is you have to be prepared for all possibilities. You must make sure that people are engaged with transparent communication. I like to feel that what we're doing here is a kind of an example of the kind of communication that needs to be done. And in fact, we're seeing more and more that leaders like Jacinda Ardern in New Zealand or like Angela Merkel in Germany, they've realized that they've got to be able to level with their people and bring their people with them on what's going on. So the preparedness we could have done was actually how governments and how other lead bodies can best prepare to make sure that they bring people along with them. Of course, there's many other features that should have been done, but I do think this focus on collective working, transparency, whole of society involvement, something that we've always said was necessary. It'd been really great if that had been something that people had in their minds the moment this started to appear as an emergency. Question 7. UN had 2 incarnations, 1920 and 1945. Do I think the COVID shock will ignite the 3rd UN incarnation with a fundamental redesign? Answer, yes. Yes. Absolutely. I don't know whether that was your question, Liviu. I think it was, but totally, things will not be the same. And I think that we should anticipate for that redesign to be happening. You refer regularly, question 8, to the key role of the African Union. Can you give some concrete examples? They're working on cross-border. They're working on where testing should be concentrated. They're working on food and hunger. And they're working on the challenges of what's happening in the economies of individual nations. I like the way in which they're working. And I also like the way that they're trying to develop continent-wide data systems for keeping an eye on what's happening. Question 9, older people are having higher fertility. Older people are having more stringent lockdown. How to overcome the ageism? That's us working with you, working with everybody. This must not, ageism as a new form of discrimination. We've got to prevent it. I just want to say that all of you, like me, anticipating the future and being strategic about it, it's the only way we will stop this particular COVID setting leading into a lot of bad stuff happening. So yes, let's work together with it. In Kenya, there's no actual provisions to facilitate access to health services in remote communities. Is there international groups that can join forces to get access to forgotten indigenous communities? Yes, 1, through getting people there, 2, through finding ways to get telemedicine advanced. And this is an absolute necessity. And yes, I know groups who are working on this. I've got access to groups. So please write to contact@4sd.info. Please, let's make sure that any of you who want help about that, we can give you the information, and we'll try to do a narrative on that as soon as possible. It's just a bit stuck in the works. Good point. Question 11. Since this pandemic is rooted in economic theories and principles that now seem questionable and problematic, are we going to get a different approach? Yes. We are hearing CEOs, admittedly front-end companies at the beginning of the sort of learning curve, saying they think that completely new ways of valuing the functioning of economies is going to be necessary. Included in that will be, of course, some measure, not just of public health capacity, but of community ability to be responsible, but it will also include valuing nature. It will also include climate action. It's happening. And I think it's happening in business quicker than in other places. So watch that space. And that says some CEOs are calling for new ways to measure what's really happening. Yeah, we've watched as Emmanuel Faber of Danone has done this. And we're seeing that a number of cities are also developing new ways of working. Amsterdam with Kate Rayworth's donut economy. I think that this emergence all the time of new ways of thinking and working, alongside the increased appreciation of the fact that we all need to work together to get COVID-ready societies in place, plus the recognition that mutual responsibility and accountability is key for the future, plus a respect for public health with its values of equity and its stress that all human lives are equal. This is the emergence. This is what's happening. We're all part of it. You kind of feel sometimes that it's a bit messy and it's going on in lots of different places, but it's happening. And so I encourage all of you through all your networks to say, yeah, this is absolutely terrible what's happening in terms of the pandemic and its consequences. But there are so many exciting new trends emerging everywhere. So how will all this be taken forward? How will these ideas be held? Is it just going to be held loosely in our networks? Or are there going to be places where it's going to be advanced? I read a report recently from a really senior WHO guy who went to one of the acutely affected countries in Europe. He came out saying, we've got to have a place where all the experiences of societies, of networks, of governments, of businesses, as they start coming to terms with COVID readiness and they see the benefits of doing it for health, impacting on other areas, and they work hard to prevent terrible ageism and to prevent other isms emerging. Yeah, we've got to have a place where these ideas are shared. And yeah, that idea is starting to emerge, that there will need to be some place where this work is done. We did it before, as Livia will remember, in something called the UN System for Influenza Collaboration. But I don't think it'll be waiting for something like that to be reinvented. I think these kinds of places for sharing are emerging super fast. They're coming in Europe, but they will come particularly in ASEAN region in Southeast Asia. Please be part of this. Please stay connected. Please, if you think it's useful, share these ideas of the open online briefings with others. Share the recordings, play with them, make your own videos out of them if you want to. Most importantly, continue to join us if you find this helpful. And if you don't find it helpful, write and tell us and say, if you really want to be useful, do something different. I'm really grateful to all of you for sparing so much time. I know how busy everybody is. Again, I thank you, and I wish you a very good rest of the day, a very good rest of the week, and most importantly, keep on inventing and experimenting and reporting and sharing. This is the time of the emergence of new ways of being and living. Bye-bye.